Let's talk about the latest COVID numbers. Now I'm joined by Professor Moshabela, Acting Deputy Vice-Chancellor of Research and Innovation at the University of Kwazulu, Natal. Thanks for your time, Prof. We appreciate it. You know, yesterday we were somewhat optimistic because we saw the numbers drop, but then we saw an increase again today. When it comes to monitoring and assessing these numbers, are we out of the woods yet when it comes to the third wave?
Greetings, Shahan, and the viewers. I think it's a very important question, and it depends on how we look at it. I think that it's safe to say that, you know, it looks like the worst is over. And I think if we can start there, for me, it gives me great comfort and consolation to actually see that in terms of cases, we are really on a downward trend. We are yet to see what's going to happen in KZN and to some extent in the Eastern Cape, because those two provinces have really experienced very, very low third waves, much lower than we expected. And so we're always in the back of our mind keeping questions around whether we might see something that happened that triggers some sort of rapid increase in either one of those two provinces. But for the rest of the provinces, we have a lot of comfort. And also we're seeing now in the past few days that the deaths in South Africa, for the third wave of the deaths, that we have entered a peak. It looks like we are plateauing right at the top of the peak of the deaths. It has not yet started coming down yet. And the good thing about it is that even though the cases for the third wave, that peak was much higher than the second wave and the first wave, the peak of the deaths seems to be lower than the peak of the second wave. And so we might actually end up seeing a situation where even though the cases were bad, the actual deaths themselves may not reach as high a peak as we've seen in the second wave, except of course we have to compare it with excess deaths and so forth, just to make sure that whatever conclusions we come up with are right. But it gives me a lot of comfort that we are entering a peak of the deaths. So we are not out of the woods yet, but really the trends at the moment are promising, I think.
Yeah, you know, I find that interesting because I was looking at the number of deaths and it was, you know, above 500, 600 at times, which was quite alarming to me. But you're saying it's not as high as the second wave. Because the question I had for you was whether or not this Delta variant is in fact more deadly, and if it's targeting younger people.
Yeah, it's a very good question. And I think we'll probably be able to give you a better assessment when all the data is including KZN and the Eastern Cape. I'm getting an impression that it may look like and this is the back of the envelope calculation, it's not really conclusive data. It looks like, you know, it was quite effective in spreading very rapidly and having a huge caseload. But it may be at the end of the day, if the excess deaths are also consistent, that the death rate may be slightly lower than we saw with the Beta variant. And that is just the back of the envelope calculation based on the patterns that we are seeing. Of course, we have to analyze it properly and kind of make more evidence-based conclusions. But for me, it's actually a surprise to see that the deaths are already peaking much earlier than we thought. And yes, we have to watch for the next week to see what will happen, but I'm becoming a little bit more optimistic.
Yeah, that's good to hear. So let's talk a bit more about this Delta variant. So what do you make of a study showing that Johnson & Johnson might not be as effective as Pfizer regarding Delta? Should we accept that we will need more boosters in any way going forward?
Personally, I don't think so. I think that we have to basically get more data in. I think that usually it's okay when you're seeing symptomatic disease being around 66%. Really, it's going to be a question of how good it is in terms of hospitalization and deaths. And so, yes, Pfizer has always been better than the others. Even with Oxford AstraZeneca, we saw that it's better. Ultimately, I do think that the conversation around boosters is going to come. Already, we are seeing that Moderna is already applying to SAPRA to actually see if they can bring in a candidate for a booster vaccine later on. And other companies are also, coming up with proposals for their own boosters. However, I do think that South Africa is really unique in the sense that we've got multiple variants that are in themselves very problematic. The alpha, the beta, and the delta, they're all very bad kind of variants combined in one place. And if we can do well, if vaccines can do well in South Africa, they are much more likely to do well in other places. So my view is that it's still premature to talk a lot about the boosters. We're doing well with our vaccination. We are seeing progress elsewhere in the world in terms of reducing hospitalization and deaths with the vaccines that we currently have. And they're not using boosters, and the outcomes are good. Mortality is mainly in people who are not vaccinated. So I think that there is reason to be optimistic and focus on what we have and expanding the coverage instead of beginning to bet on the booster. But that conversation will come, but it will probably come when we are hitting our own herd immunity in South Africa.
And of course, let's talk about SAPRA being questioned today about the use of ivermectin. There's a big push, of course, for more use of this drug. But where are we on the effectiveness of various treatments for COVID-19 outside of vaccines, which are preventative?
Yeah, we don't have anything, Shahan, in terms of promising or effective treatments for COVID-19, be it treatment for preventative treatment, preventative therapy or curative therapy. We don't really have anything. Even the things that are being battered around experimentally, they're very expensive to even explore further in our region. I would say that even ivermectin, somehow it's a lot more popular than it deserves because the data is not there to support the kind of popularity that it has. In fact, a lot of clinicians now are complaining about the adverse events that they see and the false sense of security that ivermectin gives people who have COVID, and they end up presenting to hospital very late, and the outcomes are not great. So I just think that we have to really be sober about what we are facing, that, our best bet is still oxygen as much as possible. And also if people are severely ill, a little bit of, those dexamethasone, some steroids can be used to help modulate the immune response. But right now, Shahan, we just have to accept that we don't really have effective therapy. Our best bet really for treatment people with COVID, it's oxygen and some dexamethasone. But let's do a lot more in preventing infections with vaccines as well as preventative measures.
Yeah, and of course you can still get the virus if you are vaccinated. It's just how seriously ill you get when you get the vaccine. That's key there when it comes to fighting COVID-19. Thank you so much for your time and your insight. We do appreciate it. Professor Mosa Moshabela, Acting Deputy Vice-Chancellor of Research and Innovation at the University of KwaZulu-Natal.